Hi, Dr. Philip Schalow here, and my office is the Upper Cervical Care Center. The big question is, why do we do upper cervical care? Is it only because we like taking care of neck problems? No. There's a basic principle in physiology, in vertebrate physiology, that says the head leads and the body follows. Problem there is that if the head isn't on straight, the body's not going to follow. You're going to have disorganization within the body. What does that look like? Well, right here, here's oleander. Right here, that connection between the head and the neck is critical it has to be exactly right in order for the brain to know how to coordinate the whole body. I've seen hundreds of cases where we do that little correction up there, and sometimes we just have to move it 0.05 of an inch in the right direction. The whole back straightens up, the pelvis untwists, the legs straighten out, knees straighten out, even bones in the foot move back into their normal position. Why is that, you might ask? What is it about the tibia that, are there muscles in the tibia that are able to move it laterally back under the femur? Good question. No, there aren't. There's something about how the brain has to lead the whole system. And when it does, then the body can right itself. You get organization restored. Right behind oleander here, we have a little research project that our group did. This is the baseline. This shows the venous outflow, the veins coming out of the brain. And after the correction, this shows the veins, they've expanded. So there's better outflow from the brain. So there's so many things that happen in vertebrate physiology that have to happen, and they're not going to happen if this relationship isn't exactly right. That's why we concentrate on the upper cervical region. Thank you.